Welcome to the Brain Aneurysm Foundation's first Global Day of Engagement. My name is Bendok. I'm the chairman of Neurosurgery at Mayo Clinic in Arizona, and I'm excited to share the Brain Aneurysm Foundation's vision of life without disabilities or death caused by brain aneurysm rupture. The Global Day of Engagement is about awareness and hope. We would like to raise awareness that aneurysms are treatable, and identifying aneurysms before rupture is our best chance to avoid disability and loss of lives. In this video, we hope to inspire hope through knowledge of the screening, diagnostic, and treatment methods available. It's my honor to share with you stories we have gathered from doctors who have dedicated their lives to treating and managing aneurysms. Through advocacy, research, and innovation, we will make further progress towards a world free from the threat of brain aneurysms. I would like to start by sharing our first story of hope. This patient of mine was found to have 9 brain aneurysms after being screened because of her sister, who suffered the consequences of multiple aneurysms at age 29. She underwent successful clipping of 8 of her aneurysms in 2 surgeries, and the 9th aneurysm was treated with flow diversion. The major challenge in her care was the anxiety these aneurysms caused her, which resulted in a negative effect on her quality of life. Using virtual reality tools, we were able to walk her through her brain and help her get a better sense of how we could best treat her aneurysms. This made going through 3 treatments much easier for her. We often underestimate the psychological impact of having an aneurysm. We have been working on virtual tools and engaging our psychology colleagues at Mayo Clinic to help patients better understand what an aneurysm is and how it may be better treated or observed. I'm happy to report that she has made an excellent recovery and is living life without any complications with her aneurysms and anxiety in the rearview mirror. I would like to now introduce Dr. Adam Arthur, Chairman of Neurosurgery at Semmes Murphey in Memphis, Tennessee, who will share the next story of hope.
I've been asked to talk about a challenging aneurysm case or my most difficult aneurysm case, and it's hard to do that. So I'm just going to talk about a recent aneurysm case because it had some lessons for me. The patient was a professional woman in her 40s, and 5 years previously, because of severe migraines, she'd had a relatively large posterior circulation aneurysm discovered. She'd been treated by a very good physician out of state with the off-label use of a flow diverter, and the aneurysm had shrunk a little bit, but in 5 years had not gone away. She was referred to me to talk about what options she had. You know, it's interesting. This is an unruptured aneurysm. It's not an emergency. It hadn't gotten bigger, but she's young and she's got constant headaches, and every time she gets a headache, she's worried that it was the aneurysm. I thought it could be clipped safely, and so we recommended that. I don't know that we had a lot of other good options. This was a superior cerebellar artery aneurysm with the artery coming out of the aneurysm, and flow diversion, if it was going to be delayed, was already very delayed. The surgery went very well. I did it in conjunction with a fantastic young partner, Nick Kahn, who did most of the work. We were able to clip the aneurysm safely, and although surgery for a posterior circulation aneurysm can be a big deal, she sailed through. And in a recent clinic appointment, we talked about what it meant to her to know that the aneurysm was taken care of. What's interesting is none of us live in a vacuum, and she hadn't realized that her 2 adult children had been really living in fear that if the aneurysm wasn't taken care of, it could rob them of their mother. And so not only did having this aneurysm completely taken care of give her peace of mind, it gave other people peace of mind. She's the center of an entire network, like most women in this world are, and there are other people who depend on her. So I guess, in the long run, while I'm still an endovascular first neurosurgeon for aneurysms, there are some that I think are better treated with clipping. And while we ought to do everything we can to avoid invasive surgeries, invasive surgery can provide real benefits in securing an aneurysm, protecting someone from the possibility of rupture, and providing peace of mind. This aneurysm clearly, despite the best efforts of a very talented doctor, was not taken care of. During the clipping, you could see that it was still red and there was still a possible rupture point forming at the tip. And I was glad to be able to give her and her husband and her children, and whoever else knows her, some peace of mind that the aneurysm was well treated.
The next inspiring story will be shared by Dr. Jesus Ramiro del Val Robles, Chief of Neurosurgery at Medica Sur in Mexico City.
Hello, everyone. First, I would like to extend my gratitude to my friend Bernard Bendok for his kind invitation to participate in this global day engagement of the Brain Aneurysm Foundation. I am Ramiro del Valle, neurosurgeon and chairman of the Center of Neurosurgery at Gamma Knife Radiosurgery at Medica Sur Hospital in Mexico City. Our institution is member of the Mayo Clinic Care Network. I have been treating patients with aneurysms since 1987 under a multidisciplinary approach and working hand in hand with the endovascular therapist. I am presenting the case of a woman who was 55 years old when suffered a sudden intense headache and loss of consciousness. She was admitted into the intensive care unit, and the study showed intracranial hemorrhage due to a ruptured aneurysm. The angiography revealed two saccular aneurysms, one sessile bilobulated aneurysm, and an arteriovenous malformation in the left cerebellum hemisphere. Per the endovascular team's recommendation, we decided to coil the two saccular aneurysm and place a flow diverter close to the sessile aneurysm. No craniotomy was carried out. In a second procedure, continuing with the minimally invasive strategy, the arteriovenous malformation was treated with gamma knife radiosurgery. The clinical and imaging studies follow-up has been uneventful. The multiple aneurysms and vascular malformation are totally obliterated. The patient presents no sequels and wants to share with the audience her outcome and current quality of life.
Hello everybody, I'm Marta and I live in Cancun, Mexico. And I would like to say that I am very, very happy to be able to record this video because I can tell you that after my accident, thank to God that it put me in Dr. Ramiro del Valle hands, that he fixed me. I'm healthy, I'm alive, I'm happy, I'm grateful and enjoy every single moment of my life because I have been given a second opportunity, a second chance to live my life the fullest and not take anything for granted. I don't have any disability and I feel just wonderful. Be happy, be blessed. Thank you.
The case of this patient shows us how efficient and satisfactory the result of this teamwork can be when facing a catastrophic hemorrhage, offering the patient as soon as possible the best treatment options, including a multimodal approach. A public policy focused on the early detection of aneurysms developed by a task force joining the government and private resources could significantly reduce the historical fatality of brain aneurysm. Thank you for listening, and please continue to support the Brain Aneurysm Foundation.
The next story will be shared by Dr. Ziad Hage, head of cerebrovascular surgery at Novant Health Brain and Spine Surgery in Charlotte, North Carolina.
Hi, I'm Dr. Ziad Hage. I'm the head of cerebrovascular neurosurgery at Novant Health Presbyterian Medical Center in the greater Charlotte market. I'm a board-certified dual-trade neurosurgeon, and I specialize in cranial neurosurgery as well as endovascular neurosurgery. I have many interesting cases, but the one that comes to mind is the case of Nicholas Friedman, at the time 17-year-old male that presented to us at the hospital with severe headaches and what seemed to be at the time possibly some simple partial seizures.
It was the time I was in Hawaii and I started getting like pretty bad headaches while I was in Hawaii. Started feeling a little off. But I didn't think too much of it. I thought I was like, oh, I'm just getting headaches, and they'll go away, but they didn't really go away. I don't have much information about the headaches, but the seizures, I would not necessarily black out, but I would go into this state where I wouldn't listen to anyone. I just, not really pass out, but I would just lean my head back and forget everything that happened in those 2 or 3 minutes that it happened, and then I would wake up.
And so that's what led to the workup that showed us as aneurysm. The reason why this particular case comes to mind is because it is what we call in our world a giant aneurysm based on its size, very complex in its anatomy and features. When you have headaches that are becoming worse and worse, then there's a worry about whether or not this could be something else apart from a regular headache or a migraine. Could it be a tumor, something growing inside the brain that's causing those headaches? At the time, he also was experiencing some weird feelings of numbness in his body that were very unusual, that would come and go several times a day. Ultimately, this is what brought him into our emergency room, and first thing, the emergency room physicians did was get a CAT scan. And that CAT scan showed a large rounded growth or lesion on the left side of his brain that seemed to have some swelling around it that appeared very suspicious. Next thing, he had an MRI that looked suspicious for a brain aneurysm. Again, showed a rounded large lesion measuring around 2.6 centimeters on the left side of the brain. When it comes to making the decision to treat brain aneurysms, there's two main ways, either by doing open brain surgery or by doing endovascular treatment. Endovascular treatment is less invasive. We use the endovascular or inside the blood vessel route. And so that angiogram allows you not only to really look at the aneurysm very specifically in 3D, but it also allows you to plan treatment. In his case, because of the anatomy, his blood vessels, the main vessel feeding the aneurysm was in one point narrowed down pretty substantially. We call that a stenosis. And so that, in conjunction with the amount of blood clot inside the aneurysm, basically we thought was prohibitive for a safe endovascular approach. So we had to bite the bullet in his case and effectively shut off the flow to that brain and make sure that we're able to achieve treatment of the aneurysm in 10 minutes in order for us not to give him a stroke, but also in order for us to be able to treat this aneurysm. And so I trapped it by putting a clip before and after it, effectively shutting off the blood flow to a major area on the left side of the brain. In his case, the left side of the brain controlled speech, understanding, the right side power and sensation. So a lot of very important functions, memory. That basically gave me 10 minutes to cut the aneurysm open. I used a special device, it's called an ultrasonic aspirator, to suck out all that clot. And now it became easy for me to put the clips and reconstruct the base of the aneurysm, shut it off completely, all the while keeping the native vessels or the parent vessels getting in and out of it open. Once that was completed, which was pretty unnerving because you have 10 minutes to do all that, we did what's called an intraoperative angiogram. So literally the angiogram that we do in the cath lab, we had to do inside the operating room to confirm that everything was clean and that the aneurysm was shut down, and that's exactly what it confirmed. It confirmed that the aneurysm was completely gone and the main vessels that we were really worried about protecting were wide open.
I collect comics. I go to trampoline parks whenever I get bored. I like going go-kart racing, that's fun.
And so we had a beautiful result.
Next, we have Dr. Jonathon Hodes, who is from Mayfield Clinic in Cincinnati, sharing his story of hope.
I was at work, it was November 11th, it was a Wednesday, and I just noticed that something wasn't quite right on the right side of my body. My legs started feeling a little numb and my arms started tingling. Around lunchtime, my face started feeling weird, so I called my primary doctor's office and asked if they could see me the following week because I was off the following Tuesday, and she said, no, you have to go to the emergency room. So I did. And that's when they did all kinds of testing and found out I had some aneurysms.
So when Katie came in, she had a group of symptoms that were a bit worrisome with regard to the enlargement of an aneurysm. We had evidence that there was no bleeding from the aneurysm based on the CAT scans that she'd had, but there was some indication that she may have had some enlargement of an aneurysm. The scans demonstrated that there was a large aneurysm associated with some smaller aneurysms.
I was scared to death. So, when someone tells you when you're fine and you're young and you're healthy, and then you go in for something that you think is probably insignificant, and you're just getting it checked out, and then they tell you that you need brain surgery. I mean, that's pretty scary.
So in essence, we stuffed the aneurysm with coils, the large aneurysm, and then the other aneurysms were treated by lining the blood vessel and creating a new interior so that the blood wouldn't enter into the aneurysms, and then that would cure them.
Oh, I'm doing really well. I have migraines now. I had a migraine before, but this is kind of a different migraine. Bright lights, if I'm coming out from the dark and there's a bright flash or a bright light in my eye, I'll get a migraine. Lack of sleep can cause migraines. And then other than that, I get every once in a while, I'll get little lightning bolts on this side of my vision. Very rare, like little floaters. And that's it.
So new studies have demonstrated that this particular treatment with the new lining, or what is called a flow diverting stent, that once the aneurysms have disappeared, there have been no cases of recurrence of aneurysm. So the chances of her having a problem are very low, less than 1%.
Changed my diet, so I'm geared more towards a paleo diet, and before it was more of a junk food diet. So I have changed that. I'm getting better about that. I incorporate a lot of salads into my diet. I do some exercises 3 times a week. Just try to keep healthy.
You want to look for, obviously, the worst headache of your life. If you have a sudden onset of a headache, then that's something that you want to bring to attention to your primary care doctor, or even go directly to an emergency room. And that is really a medical emergency. Other more subtle things are just being in tune with your body. And if you're aware that there's a change, if you notice something going on, maybe an increasing headache, maybe double vision, maybe blurring of your vision, maybe swallowing difficulty, perhaps some other thing that just is not normal for you and it doesn't go away in a moment or two, that's something that you should bring to attention, because those things can be quite serious.
Now it seems surreal, because it's like, oh, I did have brain surgery. I did go through something pretty significant, and it's not even been a year, and I'm doing pretty well. So I know that's not always the case. Unfortunately, some people have different outcomes, but I was very fortunate. I'm glad I had Dr. Hodes, and I'm glad I had Mayfield Brain and Spine and the staff at Good Sam. I mean, everyone was really great. Well, you can't sugarcoat brain surgery, so, and you can't make any guarantees. I mean, he can't make any guarantees either. I did watch his hands while we were talking to make sure they weren't shaking, because I need a steady-handed surgeon. But no, he was great. He was fantastic. Afterwards, we talked right before the surgery. He reiterated what we're going to do. This is the game plan. So, and he did obviously an excellent job, because here I am.
Our next story is from Dr. Rudy Rahme from the Global Neuroscience Institute at Drexel in Philadelphia, Pennsylvania. He will now share his aneurysm story of hope.
I'm Dr. Rudy Rahme, and I'm a comprehensive vascular neurosurgeon at Global Neurosciences Institute in Philadelphia. I am also a clinical instructor of neurosurgery at Drexel University School of Medicine. My involvement with aneurysms started about 13 years ago during my postdoctoral research fellowship at Northwestern University in Chicago under the mentorship of Dr. Bernard Bendok. At the time, we were studying cerebrovascular diseases in general with a focus on brain aneurysms. And some of the work went into trying to understand why aneurysms form, but the majority of the work was focused on aneurysm treatment, on improving outcomes, on improving safety of aneurysm treatment. And that includes both surgical approaches as well as catheter-based approaches. During that time, my understanding and my fascination with aneurysms grew exponentially, which led me down the path of completing a residency in neurosurgery, followed by a cerebrovascular fellowship at the Mayo Clinic. Aneurysms are fascinating entities to me, and for multiple reasons. The first reason is obviously the why. Why do aneurysms form? Or perhaps a better way to ask that question is, why do certain individuals have a tendency to form these aneurysms? What are the risk factors that underlie aneurysm formation? The flip side of the coin is, how do we treat the aneurysms? Once we find the aneurysm, how do we treat it? How do we prevent it from rupturing? How do we prevent it from bleeding, from bursting? How do we prevent it from hurting that individual? And over the last 2 decades, there's been a massive revolution in terms of aneurysm treatment, specifically with catheter-based tools. Now we have a high number of options at our disposal to treat these aneurysms. And finally, the most fascinating aspect, I think, is to try and understand why do certain aneurysms burst while others don't. What are the risk factors of aneurysm rupture? And I think that's the most important aspect of aneurysm treatment. Now, one specific story that stuck with me is a 40-year-old female, a young mother of two kids, both under the age of 10, both relying heavily on their mother. They're both homeschooled, so and rely obviously on their everyday on their mother. She presented to the emergency room with a sudden onset severe headache, and workup showed that she had a large basilar tip aneurysm. Now, anyone who's treated these aneurysms knows that these are minefields, essentially. There's so many important vessels around it. It's a high stakes territory there, and any treatment of these aneurysms comes with high risk. The concern with her was she was young, so she was a very large aneurysm, so it was a ticking time bomb, and she had 2 young kids. So from a medical perspective, we had to treat the aneurysm. From a social perspective as well, and an emotional perspective, it was very charged. Whatever we were going to do, we were going to affect not only her life, but the life of her young family as well. So we did a diagnostic angiogram, including a 3-dimensional reconstruction, and we studied the aneurysm very carefully. Now, this aneurysm was incorporated the top of the basilar artery. So it wasn't just sitting at the top of it, but incorporated it. So all the vessels that come out of the top of the basilar artery were included in the aneurysms. And clearly we could not just close them off, because that would give the patient massive stroke. So what we ended up doing is we placed what we call a Y stent. So we placed 2 stents, one coming from each side of the posterior cerebral arteries that come off of the basilar artery. And essentially, so they come down, they meet in the middle in the basilar artery, so they form kind of a cone on which the coils can sit and close off the aneurysm. So that's what we did. We went in, the stents also serve to protect those arteries from coils going into them and blocking them and causing major strokes. We placed coils inside the aneurysm. The procedure was technically challenging, but went very well. Patient did very well post-procedure. She had a bit of unsteadiness after the surgery, which was expected, but otherwise she did very well. She went home 2 days after, and I saw her in the clinic. She was doing great. I saw her 6 months later. We did another diagnostic angiogram, which showed that the aneurysm was still closed off. There's no blood flow in the aneurysm, and these aneurysms, you develop a lifelong relationship with these patients, because these aneurysms tend to continue to grow, or the coil mass inside of it tend to compact, so creating more room for the blood to go in. So I got to know her. I got to know her family, her husband, her kids, and they were very thankful for the treatment. And I'll continue to follow her for the rest of her life and for the rest of my career.
Our next story is from Dr. Laligam Sekhar, who is the professor and vice chairman of the Department of Neurosurgery at the University of Washington. He will now share his inspiring story of hope.
This is a short presentation for the aneurysm group of the Brain Aneurysm Foundation. My name is Laligam Sekhar, and I'm a professor and vice chairman of the Department of Neurological Surgery at the University of Washington, and I've been treating brain aneurysms for more than 40 years. And I have some very important advances in the treatment of brain aneurysms, in particular the development and the usefulness of skull-based approaches to aneurysms, and also the development and use of various types of bypasses for brain aneurysms. Why do I love treating brain aneurysms? These are somewhat difficult problems for patients. Sometimes they are relatively easy to treat in the right place, and sometimes they can be extremely difficult. There is something very exciting about treating blood vessel problems of the brain, and it requires a special type of person who has that personality. Sometimes treating these problems can be scary for anyone, and I wish to emphasize that it is not only the surgeon, but an entire team of people who stand with the surgeon. So today I'm going to speak about two patients, both of whom had aneurysms in childhood, and these perhaps are among my most memorable cases of more than about 1,500 patients with brain aneurysms that I've treated over the years. So the first patient was treated by me around 1997, and she was a 15-year-old girl with a giant vertebrobasilar aneurysm which had partially thrombosed. And she presented with a rapid neurological deterioration, and at presentation she was stuporous and quadriplegic. In these images up on top, you can see here the MRI scan shows that the mid and lower portion of the basilar artery. So this was a very difficult case, mainly because of the location, number one, and number two, the nature of the aneurysm, which simply requires or required some type of reconstruction. And even if we do see this patient today, this case will be a very difficult one to treat. So what happened to this patient? We first tried a more simple bypass procedure, which did not work, and therefore I had to make the decision to perform something which had never been done before, which was to place a bypass graft directly into the basilar artery. We performed deep hypothermia. That means reduction of the body temperature to about 18 degrees Celsius. And under these conditions, the patient is placed on a heart-lung machine, and because the heart stops beating, and we're able to arrest the circulation for a varying period of time. In this particular patient, it was about 25 to 30 minutes, so that we can protect the brain and yet work on the aneurysm. So here, these pictures show where we actually open the aneurysm and remove the clot, and then we expose the basilar artery beyond the aneurysm, and we had sutured a graft, a vein graft, as you can see here in these pictures, directly from the carotid artery into the basilar artery. Still think this may be one of the very few cases, and maybe even the only case, where a vein graft was sutured directly into the basilar artery. The patient actually was in very bad shape going into the surgery. However, gradually she started to recover and made rapid progress, and she recovered to the stage where she was able to go on and finish a master's program and function effectively. And an MR angiogram many years later still shows that there is a well-functioning graft going into the basilar artery. So this is probably once in a lifetime case for a variety of reasons. So the next patient whom I'd like to show you is also a very young patient whom I operated in Croatia at the University of Zagreb in conjunction with Dr. Goran Mrak, who is currently the chair of neurosurgery at the University of Zagreb, and at that time had been my fellow there. So this was a 4-year-old girl who presented with 2 episodes of severe headache, and she had some investigations performed, and you can see the MRI scan showing that she has actually 2 aneurysms which are in series with the middle cerebral artery. It is also shown somewhat in the angiogram, because the angiogram only shows the second aneurysm weakly. You can see that here. So this patient was considered for the placement of a flow diversion stent, but it would have been very difficult to impossible in this case, because the second aneurysm is really just almost exactly terminates at the bifurcation of the middle cerebral artery into 2 major branches. There's also a question, of course, here about perforating vessels coming off the aneurysm. So what we ended up doing in this particular patient is that we performed an operation where we exposed the aneurysm. We used brain protection using propofol in this patient, and we resected the aneurysms and the artery concerned and replaced it with a radial artery graft, as you can see here. And this is a postoperative angiogram, and this patient has done very well on follow-up for now more than 11 years. So I'm just illustrating 2 very memorable cases, both pediatric, and I would like for all the viewers to support the efforts to spread the knowledge of the Brain Aneurysm Foundation's Day of Engagement on September the 15th. And there's a lot to be learned, and some of you perhaps have a family member or know somebody, a friend who has developed aneurysms. There's a lot that you can learn from the resources available, and I wish you all a very great day.
Our next story of hope will be shared by Dr. Joseph Serrone, who is an assistant professor in the Department of Neurological Surgery at Loyola University in Chicago.
So our story starts off with a 61-year-old female who presented to an outside hospital emergency room after waking from sleep with a severe headache. The patient was being triaged through the emergency room, and she began to get quite somnolent, and she was urgently transferred into the emergency department for closer assessment. The emergency room physicians correctly got a head CT or a CAT scan of her brain that demonstrated bleeding consistent with a ruptured aneurysm. The bleeding on her CAT scan can be seen from this study and is evident from the light gray, which I have highlighted in red here to demonstrate where the bleeding has occurred. And you can see it's mostly on one side of her head towards the left side, which indicates that she likely has a ruptured aneurysm in that location. Subsequent to this, a vascular imaging study was obtained, which is a CT angiogram. And there's a small area near where she had the identified hemorrhage, which you can see here. And this is a classic location for a ruptured brain aneurysm. So given this, the patient was urgently transferred to our hospital and taken to the operating room for treatment. Myself and our chief neurosurgical resident, Miri Kim, then performed the operation. Given the amount of pressure that we noticed from the CAT scan and the fact that she had neurologically deteriorated prior to being transferred to our hospital, we decided to temporarily remove the bone to allow her brain room to swell in the postoperative period. We were then able to find the aneurysm, which was coming off the carotid artery. We were able to safely place a clip across this aneurysm to block it and prevent it from rupturing again. And you can see the clip placed here on the study that we got in the immediate postoperative period. From this point forward, she began to have neurological improvement while admitted to the neurosurgical intensive care unit. She was able to have the breathing tube removed about 3 days after surgery. She began to speak about 9 days after the operation and began to have further improvement in her speech, where she was putting together sentences about 2 weeks after surgery, then was conversational right before discharge on postoperative day number 20. She was discharged to a rehabilitation facility and did very well there, ultimately ended up going home. And then we saw her in clinic about 6 weeks after surgery and deemed that we needed to start making plans to have replacement of the bone flap that we had temporarily removed. And she ultimately had this done 3 months after her admission. I saw Catalina 1 month after we replaced the bone flap, and she was doing remarkably well. She was in great spirits, and she and her family sent me this photo through my email account, sharing that she was finally returning to her church services the Sunday after I had seen her. After seeing this, and this is one of the reasons I wanted to present her case, I just realized that there were so many people involved with her care, from the doctors at the original hospital to the transport team that brought her to our hospital, operative team, ICU nurses, physical therapists, residents, and I was essentially one of the only people that knew how well she was doing from the medical side of things. So I put together an email, I went through the medical record, and I drew out everyone who had been involved with her care, at least the best I could reconstruct from the medical record, and it was shocking how many people had been involved with getting her from being someone who was an extremis with a ruptured aneurysm to essentially neurologically normal and returning back to her normal routines. So 6 months after the initial bleed and aneurysm clipping, and 2 months after we replaced her bone flap, she returned to the office for a visit, and here she is. And how are you doing and how are you feeling?
¿Cómo te sientes y cómo has progresado?
Pues ahorita me siento yo bien orgullosa con el doctor, porque yo sé que
I feel better, and I'm really proud of having Dr. Serrone as my physician, because he has helped me a lot, and I know that even though I feel better, over time I'm going to feel a lot better because my brain is healing.
Right. Can you just describe in your own words what are the maybe one or two things that, even though you're almost 6 months out, you're still kind of experiencing and you're still working through?
Dice que si puedes describir una.
Siento que por dentro no siento como me sentía cuando no estaba enferma. Entonces he platicado con algunas personas y me dicen que es como cuando está uno enfermo de la mano.
I'm not the same person as I was before.
Mm-hmm.
I feel like I'm not myself, but I have spoken to people and they have told me that even though I'm out,
Mm-hmm.
I'm out of the brain aneurysm,
Right.
that I'm still healing, and they told me that it's like, for example, like when you have like when something happens to your arm
Mm-hmm.
or your legs, you have to give it time to heal.
Yep.
That's the same thing. That's how I feel, that over time, since my brain is healing, I'm still gonna sooner or later I'm gonna feel like myself.
Okay. All right. Thank you for sharing that with us. So that's Catalina's story. It started off in a very serious state and ultimately has had an outstanding outcome. And I'm very appreciative to her for allowing us to tell her story through the Brain Aneurysm Foundation. I think it's very important for other people to hear what people experience and how that course goes about. I'm very thankful for her family. They went from having a mother who was lively and doing well, and things turned badly very quickly. And we brought her into our hospital. They trusted us with her care, And over a 3-week hospital course, they were remarkably strong. And I think that's one of the reasons she's doing so well also. And last, I just want to say thanks to our team at Loyola. It really requires multiple disciplines to take someone as sick as she is and get her back to functioning how she is today. And that goes through our resident team, our ICU staff, the physical therapist, and everyone else that was involved. There's almost too many people to name. The patient, the family, and I hope it's useful for anyone that's experiencing a brain aneurysm.
Our next case will be shared by Dr. Daniel Surdell, Professor of Neurosurgery at the University of Nebraska Medical Center.
My name is Dan Surdell, and I'm here with my friend and colleague Bill Thorell, and we were going to present an interesting aneurysm case that we took care of years ago. Several years ago, we took care of a 33-year-old who was transferred from an outlying hospital with a sudden severe headache, worst headache of her life. Common presentation for a ruptured aneurysm, and they did a CAT scan at the outlying hospital that demonstrated a subarachnoid hemorrhage. And so she was immediately transferred to the University of Nebraska Medical Center. It was an interesting case because she was a young woman, age 33, and she was 34 weeks pregnant with twins. We discussed multiple scenarios and immediately consulted our OB team. And it was ultimately decided that after that consultation that we would proceed with an endovascular solution to treat her aneurysm. She was monitored during induction of anesthesia, and during that induction, there was decelerations in one of the fetus's heart tones, and then fairly soon after that, there were decelerations in the second fetus's heart tones. At that point in time, the OB attending decided that the patient needed to have an emergency C-section. And so we were in the angio suite, and the angio suite basically became a delivery room, and the OB doctor successfully delivered 2 healthy twins, and they were immediately brought over to our second angio room, which was converted into a nursery. We then proceeded with, once the mother was stable, with an endovascular treatment, and this aneurysm was a complex aneurysm. We created a model of this in our IXL center with the help of Bill Glass, and there's a QR code linked in this video that you can manipulate to see this aneurysm. There were 2 lobes to it, and we decided to use a 2-catheter technique in order to simultaneously treat both aneurysms. We were able to successfully treat that, and the mother and the child did well. I think this case highlights a lot of things that I really enjoy about working at the Med Center and taking care of these patients, which is the ability to work with friends and colleagues who are like-minded, and the team approach that we take. And everybody on the team plays a really valuable role. And this case highlighted that to me because we had our techs and our nurses in the room helping us as we were taking care of really 3 patients at one time. And then we also had our anesthesia providers and our OB providers who just were terrific in assisting in the care of what became a more involved scenario. But because everybody was involved in the upfront decision making, I thought that the actual course of events played out very well.
I agree. For me in particular, when before Dan had joined me, I had a patient who was pregnant and had a ruptured brain aneurysm, and in that particular case, unfortunately, the patient and the baby both passed away. So for me, there was an additional stress that came about with this case because I'd been in this position before, something very similar, and I was very anxious, obviously, to not lose more people. Now you've got twins. You're trying to make decisions on things that you're not an expert in. Obviously, the obstetric care, that's really where the teamwork had to come in. And, because you have to defer in those cases to the obstetrics team to say, okay, you're not dealing with just ruptured aneurysms and an anesthesia team. You're now dealing with 3 humans all simultaneously sick. And there's a lot of give and take in terms of trying to figure out the best management in order to take care of really 3 lives all at once.
And then I also think it's an interesting case because this was a very young patient.
Yeah.
And so oftentimes I think we think of aneurysm rupture in older patients or maybe patients that are unhealthy for other reasons. But this was a healthy young person.
Yeah.
And so just being vigilant about symptoms of ruptured aneurysm, which is sudden severe headache. And it was also the sudden severe headache in a pregnant woman leads to a wider differential diagnosis. Thank you. I hope you enjoy this presentation.
Our next story will be shared by Dr. Erol Veznedaroglu, professor and director of Drexel Neuroscience Institute at Drexel University's College of Medicine.
Hi, my name is Dr. Erol Veznedaroglu, and I am a cerebrovascular endovascular neurosurgeon. I'm the chair of neurosurgery at Drexel University College of Medicine and am the CEO of Global Neuroscience Institute. I absolutely love treating aneurysms. I've been treating aneurysms for over 2 decades. And one of the reasons I love them is just because of the complexity of each and every aneurysm. Each case is truly individual. And patients who are diagnosed with aneurysms, whether it's elective or ruptured, is a clearly life-altering event. And to be able to take patients and either get them through that journey electively or save their lives from a ruptured standpoint is just the most rewarding thing I think a physician can encounter. The case that I remember most is actually fairly recently, and a physician who worked at our hospital. She's going to be on the video that you'll see attached to this, and you'll hear from her own words. She had a very complex ruptured basilar aneurysm, was seen in an outside institution that really had difficulty addressing the best treatment for it. And it was one of the more complex aneurysms because the whole vessel was diseased, or what we call dysplastic. You can see in this picture the whole end of the artery is just completely diseased. This is the basilar artery, very critical artery with many small little arteries coming off that really can't be sacrificed in any way, shape, or form. We were able to get a really good result with a stent-assisted coiling technique, which is a little bit old school, but it did the trick. And on her most recent angiogram at 6 months, it remains cured. We'll see long term, but she's doing absolutely incredible, and she's going to show you and speak to it for herself. And with that, Dr. Padano, if you want to share with the audience your story.
It was a Friday afternoon. I just got home from work, and I was resting, and all of a sudden this headache came upon me like I had never experienced before. I felt like my head was going to split open and my teeth were going to fall out. And I called one of my friends who was a physician just to make sure I wasn't hallucinating, and I said, "This is the worst headache I've ever had," and he said, "Get to the emergency room." So I went to the emergency room, and they CAT scanned my head and didn't find anything. My blood pressure was a little elevated, so they thought it might be due to that, and they sent me home, and the headache persisted. And Tuesday night, I didn't feel quite right, and I called my sister. She said I was slurring my words, so she came over with her husband, and I proceeded to cardiac arrest in front of them, and they started CPR and called the ambulance. And that was the last I remember. The next thing I knew, I was waking up, and I was in a rehab facility.
So really the importance here is diagnosing that bad headache yourself and not blowing it off, not forgetting about it. And you're not a headache person, right?
Never had headaches.
Yeah, so I think that's another really important factor. People that don't have headaches, but even people that have bad migraines, when an aneurysm leaks, they know that this is a very different headache, very different severity, and something's not right. And as you see here, even going to the emergency room with a normal CAT scan, up to 10% of the time, a CAT scan can be normal because there's a leaking aneurysm, but there's just not enough blood to detect it. And within 24 hours, you can see this is a pretty dramatic course of events, where going from a headache, not feeling right, to literally cardiac arrest. Andrea was transported to a closer hospital to where she lived. She was in the ICU there for 2 days. They put a ventriculostomy in, which was a life-saving procedure because the pressure in her head was so great. There was discussions, if you remember at that time, of withdrawal of care. So the other really important lesson here is there are certain aneurysms where you really need to be aggressive. You need to be aggressive with a ventriculostomy to decrease the pressure in the head and also to treat. And as you can see, Andrew's back to work. And actually, I can say in my 23 years, you are the quickest back to work, the quickest, really almost remarkable recovery that I've seen. She was within weeks back in the office fighting with me when she could go back to work and as an airline pilot, right, get her flight pilot license back. So again, the take homes here, do not ignore headaches, particularly if it's a severe worst headache of your life. And be your own advocate. You and your family have to advocate for you so you can get everything that is out there to benefit your recovery, as Dr. Cadano's done. Thank you.
Our next story is from Dr. Pascal Jabbour, who is the Angela and Richard T. Clark Distinguished Professor and Division Chief of Neurosurgery at Thomas Jefferson University in Philadelphia, Pennsylvania. He will now share his story of hope.
Hi, my name is Pascal Jabbour. I'm a professor of neurosurgery and head of the Division of Neurovascular at Thomas Jefferson University Hospital in Philadelphia. I am trained in open vascular techniques and endovascular techniques. I would like to congratulate the Brain Aneurysm Foundation for their day of engagement, and I would like to share with all of you the story of a patient who presented to our hospital with a ruptured aneurysm. This patient was found down at home. She was brought to our hospital and she had a massive subarachnoid hemorrhage and an intraparenchymal hemorrhage with mass effect on the brain. The CTA showed a ruptured MCA aneurysm. So I took her emergently to the operating room and did a decompression and clipped her aneurysm and evacuated the hematoma. Because she had a familial history of brain aneurysms, I recommended for all the family to get screened with MRAs, and 2 of her daughters came back positive with brain aneurysms. So I treated the first patient with coiling because her aneurysm had a narrow neck. So the architecture of the aneurysm was such that coiling would be the best option. Then I treated the second aneurysm with an intrasaccular device. It's like a cage that we place inside the aneurysm, and it will cause the aneurysm to thrombose. Both patients did well, and their mom also, after a long time in rehab, improved a lot and became nearly independent. This story shows that there are multiple ways treating brain aneurysms, and we are lucky because we have so many tools and we are able to treat more brain aneurysms with all those tools that we have. It also shows that some of the aneurysms can be familial. In this case, the patient had a familial history of brain aneurysms. That's why I recommended screening the family, and turned out that 2 of her daughters were positive with brain aneurysms. And the goal is to try to treat the aneurysms before they rupture to have a better outcome.
The next story will be shared by Dr. Christopher Ogilvy, who is Professor of Neurosurgery and Director of Endovascular and Operative Neurovascular Surgery at the Beth Israel Deaconess Medical Center Brain Aneurysm Institute.
My name's Christopher Ogilvy, and I'm a neurovascular neurosurgeon, and I'm honored to have been asked to relate a story of hope regarding intracranial aneurysms. And I have so many. As neurosurgeons, we're privy to the private lives of so many people and their families as they deal with this sometimes devastating problem. One patient in particular comes to mind, a young individual who is in his late teens, had a terrible hemorrhage. And we were able to perform endovascular treatment on one of his aneurysms, and as he recovered, treated another intracranial aneurysm with surgery. But the amazing thing about this individual was his family's coming together and surrounding him with love and hope. And he has made an incredible recovery. He went on to college, He is a functioning member of society. He is a great individual who contributes and gives back to others with brain aneurysms in the form of support and guidance. And this type of thing happens every day. These hemorrhages can be devastating. They can split families apart, but much more often I see them bring families together. They closen up, they support each other, and it's an incredible source of joy and pride as we see these patients and their families get through this sometimes very difficult disease. This is true also for unruptured aneurysms. I'll finish by saying that it's Brain Aneurysm Awareness Month in September, and there's a call to action day on September 15th by the Brain Aneurysm Foundation, which continues to provide support and fund research, important research, to help in the fight to detect and treat brain aneurysms. Thank you very much.
I hope that you found this video to be as impactful as we did. I hope that the vision of life without disability or death caused by brain aneurysms unifies our efforts to achieve our goals through appropriate screening and innovative research. Thank you so much for joining us for the Brain Aneurysm Foundation First Annual Global Day of Engagement. We appreciate your continued support. We will continue to work together towards a vision of life without the threat of disability and death due to cerebral aneurysms.